right. Good morning, everybody, and thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a couple minutes here to click buttons to make sure that all of the media who've joined us have permission to record. You will have permission to record this briefing, and we are also recording, and a link to that video will be made available on our website and YouTube channel later this morning. Just give me just a minute. Okay, I think I have given everybody permission, but if you run into any problems, please send me a message in to the Joint Information Center using the chat feature. We're joined today by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of our speakers will give an update, and after each of them have shared their remarks, we will take questions using the chat feature. Please be sure to submit your questions to everyone so that all of our speakers can see those questions. Thank you for joining us. And with that, I will turn it over to Executive Summers.
Great. Well, thank you, Carrie. Good morning, everybody. First off, I'd just like to start by mentioning the excessive heat watch that Snohomish County is going to be under from tomorrow through the weekend. It looks very likely that we have a chance of being over 100 degrees again. So those that are vulnerable really need to plan ahead. Urge everyone to please look out for those in your family or neighbors who may need some help, may not have air conditioning, and just might need a place to be to keep cool. So check on your parents, grandparents, neighbors, anybody that doesn't that you know that doesn't have air conditioning. Also, really, please make sure your pets have all the water and shade they need. It's vitally important that they keep cool also. So a few words about COVID-19. I've been reflecting about the last year and a half and lessons learned. And I really think for me, it boils down to three key takeaway points or facts. The first is that there's seems to be medical consensus that if you haven't had COVID-19 yet and you're not vaccinated, you will probably get it. Very likely to get it. You're susceptible, and the disease is very transmissible, and it's everywhere, so you're likely to get it. The second key point is if you haven't been vaccinated, you're at much greater risk of severe illness or death. It's very contagious. It's very dangerous, and if you're unvaccinated, you're at much higher risk. If you are vaccinated, you have a much lower chance of getting seriously ill or dying. And in fact, a doctor can speak to this, but the vaccine is very effective of keeping people pretty much out of the hospital and out of severe danger. So if you haven't had it, you're going to get it. If you're not vaccinated, you're at greater risk. And if you are vaccinated, you're protecting your health. So I just really know every person needs to make important decisions. If you want to live, you should get vaccinated. If you want to avoid long-term consequences of COVID-19 and all the suffering that comes with it, please get vaccinated. If you want to keep your family members safe, they should get vaccinated. And if you want to keep our hospitals open and available for other things beyond COVID, we need to get everybody vaccinated. Our capacity is almost full in Snohomish County. And if you're suffering from a heart attack or something, you want a place to be able to go. And that's questionable at the moment. So please get vaccinated. Given billions of COVID-19 vaccines out around the world, it's safe, it's effective, and it's our path out of this. So that's it for me today. With that, I'm going to hand it over to Dr. Spitters of the Snohomish Health District. Thank you.
Well, thank you, Executive Summers, and good morning, everyone. I'd like to reinforce the executive's comments about the upcoming heat wave. Stay hydrated, take cooling breaks, or seek an air-conditioned environment. And as Executive Summers mentioned, look out for others, family, friends, neighbors, employees, coworkers, pets, and particularly the very old and the very young are most susceptible to heat-related illness. For more tips on how to stay safe and healthy in the heat, as well as an updated list of cooling shelters, please visit www.snowhd.org/weather. Moving on to COVID news, our situation continues to be alarming in Snohomish County. Reported cases over the past 3 weeks have doubled from looking back the week ending July 24, 651 cases reported during that 7-day period. Then the next 7-day period ending July 31, 1,000 cases. And now for the 1 week period ending August 7, 1,300 cases. In addition to the doubling in just the past 2 weeks, these figures represent a nearly 400% increase in weekly case reports since July 1. The 2,300 total cases reported together in the past 2 weeks corresponds to a 2-week rate of 280 cases per 100,000 individuals, exceeding CDC's threshold for designating us as a high transmission county. That threshold is 200 per 100,000 for 2 weeks. For visualization of these trends, please visit the Health District's COVID-19 case counts webpage. Last week, we had more than 600 close contacts identified in child care facilities alone, and at least 15 long-term care facilities currently have at least one confirmed case. One of our major healthcare facilities reported its highest testing and highest positivity rate ever in a single day yesterday. Over the past month, countywide testing has increased from about 7,000 to 8,000 tests per week up to 11,000 tests per week last week, and the positivity rate has increased from 2 to 3% up to greater than 10%. That clinic I mentioned yesterday tested over 1,000 people and had over 150 positives, 15%. Health district testing sites have exceeded capacity in recent days, and we're looking at how to increase capacity. Meanwhile, hospitals continue to see increases in new COVID patients on top of the recent surge of hospitalizations for non-COVID conditions that already were stretching their capacity. As of this morning, we have 62 hospitalized COVID patients in the county's hospitals, including 4 on mechanical ventilation. That is a tripling in the number hospitalized since 22 were in the hospital on July 24. Intensive care units in the county are operating at 90% plus capacity, leaving little room for additional COVID or non-COVID surges in demand for care. Again, as Executive Summers mentioned, vaccines are our best tool against COVID-19. During the month of July in Snohomish County, case reports and hospitalization rates for vaccinated people were about 1/10 per capita the rates in unvaccinated people. So that's roughly 90% protection against becoming a reported case or getting hospitalized. But only 54% of the total county population has completed vaccination and is benefiting from that. We still have nearly 250,000 individuals over 12 years of age not yet having started vaccination, along with 125,000 children under 12 years of age who are not yet eligible for vaccination. There is some good news. We did note an increase in new vaccination starts during the first week of August. That's the most recent week for which we have data. With 4,500 new people getting their first dose, that's up from about 3,000 per week over the preceding several weeks. But we need to go faster than that. I strongly encourage all eligible people who have not already done so to start and complete vaccination as soon as possible. Vaccination will protect you, the people around you, and those who cannot get vaccinated. For more information on how and where to get vaccinated, visit the Health District's COVID-19 vaccination page and select the icon for how to get your shot. I've covered vaccine breakthrough cases, that issue, in recent briefings, and I won't go over it in detail again, but just to mention that even with these highly effective vaccines, some cases will occur in fully vaccinated people. That's been true even more so since the Delta strain picked up speed. So we really need to be thinking now in terms of vaccination and masking in public rather than vaccination or masking. Vaccination today will prevent severe disease and hospitalizations about a month from now, but putting a mask on today will prevent that in just 1 to 2 weeks. The University of Washington's Institute for Health Metrics and Evaluation's most recent COVID-19 briefing for Washington State on August 5 projected that rapid adoption of universal masking could prevent up to 1,500 cumulative excess deaths due to COVID-19 between now and December 1. That's statewide. That would represent roughly 150 saved lives in Snohomish County, hundreds more hospitalizations, and thousands more cases. We need to act now to curb transmission, to protect hospital capacity, and to keep our schools and our businesses, employees, and customers safe. This is why today I am issuing a new masking directive. Effective August 12, everyone 5 years of age and up in Snohomish County must wear a face covering within indoor public spaces. This directive applies to indoor spaces that are open to the public, including retail, grocery, government buildings, and other businesses and places where members of the public can freely enter. It does not apply to indoor non-public spaces, including businesses, offices, and other places of employment with limited access. Employers in those settings should continue to follow current guidance and requirements from the Washington State Department of Labor and Industries regarding worker safety. This directive also does not apply to outdoor places, although I strongly recommend wearing a mask in outdoor settings when a distance of 6 feet or greater cannot be maintained between households. As a reminder, everyone who is unvaccinated is required by the Washington State Department of Health Secretary's order for masking to wear a mask in public, and everyone, regardless of vaccination status, is under that order also required to wear masks in correctional facilities and jails, homeless shelters, schools, childcare, public transportation, and healthcare settings, including doctors' offices, long-term care, and hospitals. That is all in accord with existing state requirements already in place. This directive will remain in effect until the Snohomish Health District confirms that COVID-19 disease rates decline to low levels of transmission as defined by the CDC, or until this directive is otherwise rescinded. I strongly urge all people in Snohomish County to voluntarily comply with this directive, and likewise direct all businesses that are open to the public, including grocery and other retail establishments, to continue implementing policies and practices to ensure that their customers and employees wear face masks in order to protect the health of their customers, workers, and the community. The full text of the directive will become available later today on the Health District's website. So please wear a mask in public settings, get vaccinated if you haven't already, and encourage or help others to get vaccinated too. COVID is still with us, and we need your help to get it back under control. With that, I'll hand it back to you, Executive Summers.
Thank you, Doctor. A couple questions. First, is the county going to mandate vaccinations for any or all county employees? If not, why not? And there was a follow-up, similar question about King County and Seattle. So we just really received the details of the governor's actions and King County's actions yesterday. We are looking at those requirements in the system they've put in place to see how it might apply to Snohomish County. So that decision has not been made yet, but we're taking it under careful advisement. And obviously we will be talking to Health District Dr. Spitters about actions such as that, but have not made that call yet. Let's see. Doctor, really for you, how limited is your hospital capacity right now in the county? Could you compare it to a previous point in the pandemic? You're on
unmuted. There we go. Well, so there's two factors at play here. One is the number of hospitalized COVID cases, which at the current time is roughly 1/2 to 2/3 of the peaks that we saw with the first wave in spring of 2020 and the third wave, which occurred in the December-January period. That peak, county hospitals were up around a maximum of about 120 COVID cases. Now, the additional challenge at this time, making the current numbers, I think, worse than that sort of 1/2 to 2/3 of the worst case scenario thus far, is that prior to this wave, local area hospitals have been having a non-COVID medical surge just due to a variety of urgent needs for acute care, some of which was made worse by COVID leading to delays in people seeking care or being able to obtain care. So that's where things are at. The ICUs, as I said, are running at about 90% capacity, a little bit more capacity on the general beds. And for a closer view on the hospital's experience, I encourage you to reach out to their media relations folks and get their story directly. But we are concerned, and this is a statewide issue as well, so that you remember we're not an island. So one, if we run out of space, we need to send folks to other parts of the region or state to get care, and the converse is true. So we really have an interest in the whole region really getting the COVID situation under control, so that we don't tip our own hospital system here locally, regionally, or statewide into further duress, where they need to pursue, given lower levels of care in order to take care of everyone. They're not at that point yet, but staffing is short and much shorter than it was earlier in the pandemic as well. So that's contributing to the pain as well. But do reach out to the hospitals and get their take on this, I urge you.
So, Doctor, maybe you can start on this one. At this point, what's your biggest concern in the pandemic? Vaccine rates, hospitalizations, or something else?
Well, I think just the current trajectory and level of case reports and hospitalizations are concerning. Fortunately, we haven't seen a lot of deaths or a big increase in deaths. Now, that often lags behind the increase in cases and hospitalizations, so there's still to be determined, but previous experience and forward-looking hope is that the vaccine coverage continues to provide protection against that most severe level of disease and death. But I think my main concern is the current convergence of three factors. One, the more transmissible Delta variant. Two, incomplete vaccination effort, where we've got almost half of the population of the county yet to start vaccination. And then three, we've been gone for about 6 weeks or so now with reduced prevention measures, with masks at the top of that list, but not, there are other things in there as well, like trying to spread out, reduce the amount of time we spend around people whose vaccination status we don't know, reduce gatherings, that kind of thing. And so I think it's no coincidence that the timing is what it is. But those three factors together have us moving pretty fast. And this trajectory is as fast as any of the previous waves. And that R factor, the number of new infections per initial infections, is as high as it's ever been. And so we really need to get vaccinated, put the masks back on, try to spread out a little bit more, and respect the virus.
Yeah, I guess from my standpoint, obviously our number one goal has been to save lives along the way. And I guess it's a little frustrating that we have a way to do that. It's pretty simple. It's a vaccine. And as I pointed out earlier, if you haven't had COVID, you're likely going to be exposed to it or get it. And there's a very easy path to protect yourself from serious disease and perhaps death, and that's a vaccine. So we have a path out, but it's about saving lives. And, secondary to that or associated with it is hospital capacity has always been a concern. that if we really exceed the capacity, there's other things going on in the world. There's other diseases, there's heart attacks, there's a lot of things that need emergency treatment. And if our hospitals and facilities are full of COVID patients or challenged by high numbers, then that starts affecting other people and their ability to get health care. So it's, this vaccine is a useful tool to get us around that. But the virus is not going anywhere. Obviously, it's very contagious. It's going to be with us for a while. So we just need to take every measure we can to slow it down and protect our hospitals and save lives. For me, that's it. So if hospitals continue to fill, will you consider more drastic actions? Can you tell us what measures you've considered, like a return to business restrictions, Doctor?
Well, these considerations are always out there, and arriving at them is a team sport. But certainly, I would say to protect the community and to preserve acute care capacity and prevent these death and suffering, we're I would say anything is potentially on the table. What would trigger such a return to such measures remains to be determined. And but I would say nothing that we've done before is completely off the table, because we don't know what lies ahead. So I couldn't make a promise to the contrary. So any of those are possible, but again, it's in our hands. We can bend this curve as we've done before, get things down, get vaccinated, put the masks on, cool it on gatherings with that include unvaccinated, unmasked people, and try to get through this. One thing I'd like to add to my previous comment toward that end is that about one of my greatest concerns is our collective exhaustion with this pandemic. I'm tired of it. My family, my personal life, my family members' pursuit of healthcare has been affected as well. And it's exhausting, and we all want it to be over, but it's not. It's not over. And we always want this current, whether it's the Delta strain or the fifth wave, to kind of be the last thing between us and freedom from the virus. But, history is teaching us that that's not the way it goes. So we've really got to collectively adapt to a new normal. And, hopefully indoor masking will become a thing of the past, or maybe it'll have to be something that comes and goes depending on where the virus, how this situation evolves. But I think one of our greatest dangers is prematurely wanting this to be over and taking actions that fulfill that desire, but that are contrary to all of our best interests.
And Doctor, this one's probably for you too. How are long-term care homes holding up during the fifth wave?
Well, as my comments mentioned, we went for several months there with virtually no COVID activity in long-term care facilities. It's still relatively low in each of the 15 places. There's one that had a somewhat larger outbreak. Quite often, the first case is an unvaccinated healthcare worker in the facilities, and so we welcome toward that end, we welcome the governor's mandate for healthcare workers to get vaccinated to protect those vulnerable residents. And we have seen a few breakthrough cases in long-term care. But currently, overall, things are still manageable there. But another thing I ask you to remember, everyone out there, is healthcare staffing in general is a challenge right now, not only for hospitals but also for clinics and for long-term care facilities. And that makes pursuit of healthcare difficult, and unvaccinated healthcare workers getting quarantined or getting COVID and taking them further out of action only worsens the matter. So I really urge all unvaccinated healthcare workers out there, especially those caring for our most vulnerable members of society, to get vaccinated today.
Do we know what the vaccination rates for long-term care facilities is? Have they dropped with turnover in facilities as the vaccination program was winding down?
I can't tell you. Those aren't numbers that we have direct access to. Last time I saw something in the range of 60 to 70% coverage in long-term care. Acute care is more like 70 to 90, depending on the healthcare system and the facility. And of course, we're now aiming by October 18 to hit 100% in all those settings, and hopefully we get there much quicker.
Question, how likely do you think folks are to follow the new masking directive? I guess I'll just say, we had pretty good compliance this past year, I think. Thank you, Eric. We had pretty good compliance. I think people are paying attention. You're seeing the news from not only Snohomish County, but the region, state, and nationally about this recent surge. So I'm hopeful that people are comfortable enough that we'll get good compliance, but that is yet to be seen. I don't know if you want to address that, Doctor.
Well, my hope is 100% compliance, but I think that the main thing is we want to remove any ambiguity about what the desired action is, and that's that we all wear a mask in public settings. Now, and so this is a step toward making that further clear for all of us, and for businesses, especially in the community, so that they feel empowered and there's not the potential ambiguity of a recommendation as opposed to a directive. And so, hopefully this is empowering to all of us out there to proceed with this. And those who don't comply, face their own risks, and the other is, I speaking for myself, and if there's a place that I go into and there's not a lot of mask wearing, I'm going to get out of there. And so I think, trying to comply with this is good for people's health, and it's also good for business in the long run.
This question, I don't know if we have any information on this, but how much attrition there's been in healthcare staffing through the pandemic? Have any data on that?
Yeah, that's not something we have data on. That's something you'd have to go to the healthcare system about, and probably even system by system. I don't know that there's any collective information about that. But needless to say, at least qualitatively, there's been a lot of people retreating from the profession in a variety of ways, either early retirement or pursuing other things. This has been maximally stressful on people working in healthcare, and not everyone has stayed on. So we have that to deal with as well, not only in the pandemic, but then as part of our recovery, moving beyond is getting our healthcare system staffed back up.
And the last question I see is, do you think a statewide indoor mask mandate could be inevitable to turn the tide?
Well, I think it would help. And whether it's deemed necessary or inevitable, I would, direct that question to our partners at the state level.
Okay, I think that's all the questions I see.
Okay. We were going to go ahead and wrap up the media briefing this morning. Thank you for all of your questions. And we will, again, post the information for the masking directive later this afternoon, as well as a link to this video. Please stay tuned for future media availabilities.